Thank you for having me.
Just quickly, tell us about the idea that the youth of today have about being more worried about falling pregnant than becoming HIV positive.
I think that is not just a South African phenomenon. It has been experienced in other countries and other sections of the world. One of the biggest issues for young people, pregnancy is an immediate thing. It will show as soon as it happens. However, HIV-Aids takes years. It takes months for anyone to actually show the signs and even the stigma to start in parts of the community. So young people actually are more scared of being seen and of pregnancy showing and on having a baby and of everything that everyone within the community and the family will be thinking about them when they have a baby. Actually, some young men view it as impregnating a person's child, and so it becomes that issue, the fact that pregnancy will show.
Yeah.
However, HIV/AIDS, it doesn't show immediately, so I think that is one of the biggest challenges with the fight. However, there's a common denominator between HIV and pregnancy, and that is sex. So we would like societies and everyone who are in the program to promote dual prevention.
I want to escalate discussion and talk a little bit about the exploitation of teens and the high-risk group of new infections that seems to be the 15 to 19-year-olds. Is that unique to South Africa?
It's not necessarily unique to South Africa. I think generally the average age of debut is around 15 to 18 all over the world. I think it tends to be more prevalent in low-income countries and in countries where there is a higher level of poverty, but also in other countries, I think according to one of the reports, where adolescents' marriages or child marriages are thrive in those areas or are part of the cultural norm. And so you would find that in those areas, that age group becomes more vulnerable. But also that age group is the age group that is of young people who are biologically risk takers, but also who are experimenting with life, who are transiting from childhood into adolescence and later into adulthood. So a whole lot of things happen there. So how we handle that age group defines how a young person responds to
Is that part of the sugar daddy problem that we have, that's so often being spoken about? And these sugar daddies, do they often force young women and men in some instances to have unprotected sex?
Definitely, the sugar daddy phenomenon and sugar mummies, now we know about Benson's, are some of the factors. There are two components there. The young people might be forced, but they might be forced by circumstances. So they might be forced by an older person who is in the position of power, an older person who would be twangling luxury items or actually even the basic items that a young person needs. But also there's another component where it is not necessarily about like the luxury item. A young person gets into the relationship and finds that when you're in a relationship, there is no turning back. The older man will always have a more powerful position. And then there's rape. So there's always going to be a number of reasons, and when we deal with those issues, we have to deal with what are the fundamental issues. But yes, sugar daddy syndrome is also one of the biggest, especially in South Africa.
Finally, there's going to be a lot of partying and among the youth of South Africa and a lot of risky behavior. What would your tips be to young people, not just in South Africa, throughout the continent over the next month, for them to reduce their risk of getting HIV?
There's a number of things. Transition, it brings about excitement. So I think as we transit as young people, we have to remember that this is just a month, it's just a phase. The effects and the implications are long-term. They might affect your future. But also there are things that we probably cannot avoid. Young people want to have fun. But when you have fun, you have to have fun and have responsible sex if sex is part of that transaction.
Of that fun.
It is part of that fun. I think we have to also make sure that young people actually use less and less substances because there is a very clear a link between substance abuse, particularly alcohol and drugs, with risky behaviors and irresponsible sex. So those are some of the issues that we want people to be wary of. But young people also walk in groups, go to events with friends who have positive influence in your life, who will be likely to actually remind you what you're doing and what you're not doing. Look after your drinks. Drinks tend to be spiked, and whatever you drink, you might think that you're still just drinking a glass of cider, but a person might have dropped something into your... So there's a number of things, but the biggest one is when you are going out and you are with your friends, make sure that your friends can also take care of you. You can also take care of your friends. Try to be in groups which actually aspire to have positive influence, and that's what we're going to.
Thank you very much, Dr. Andile Dube, loveLife's Executive Manager, giving us an insight as to what we need to do over the festive season to keep ourselves safe. Thank you once again for joining us. We stay with the theme of age, but we move on.